हेलो गाइस, मेरा नाम है सुब्रत एंड आई एम ए सेकेंड ईयर एमबीबीएस स्टूडेंट एट जीएमसीएस सुंदरगढ़। तो आज हम कंटिन्यू करेंगे हमारे सेकेंड ईयर की हिस्टोपैथोलॉजी सीरीज को, जिसमें कि आज का जो हमारा वीडियो होगा इट्स गोइंग टू बी ऑन ऑस्टियोक्लास्टोमा। सो लेट्स स्टार्ट द वीडियो। सो व्हाट इज ऑस्टियोक्लास्टोमा? It is a benign, locally aggressive bone tumor composed of osteoclast type multinucleated giant cells and neoplastic stromal cells. In this image, you can see these are the osteoclast-like multinucleated giant cells, and these are the neoplastic stromal cells. So now let's see the key facts. It is benign and locally aggressive. It has high occurrence rate. The age group is 20 to 40 years. It occurs after closure of epiphysis, mostly in the skeletally mature individuals. It is more common in females as compared to males. So now let's see the most common sites. It is most common in knee joint, in the distal femur and proximal tibia. And the other sites are distal radius, proximal humerus, vertebral body, and jaw bones. The characteristic site is epiphysis with extension into metaphysis. So now let's understand this. This is a bone and this is the epiphysis. This part is the metaphysis and the rest are the diaphysis. So the location of the tumor is epiphysis that extends into the metaphysis. Epiphysis that extends into the metaphysis. So I think you are clear. In this image you can see this is femur and this is the distal part of the femur, which is most common part. And if the tumor occurs in the tibia, then the most common part is the proximal part of the tibia. So now let's see the gross. It is a soft friable tumor. The red, brown, and black areas are due to hemorrhage, hemosiderin deposition, and high vascularity. There is presence of necrosis, yellow areas containing lipid-laden macrophages, and there is cystic degeneration. In this image, you can see the red area is due to hemorrhage, hemosiderin deposition, and high vascularity. In the yellow area, where there is presence of lipid-laden macrophages. So now let's go to the clinical features. It is painful, there is presence of swelling, restricted joint movements, and pathological fracture. So now let's come to the radiological findings. There is presence of lytic lesions. It is purely osteolytic and no sclerotic rim. So what is a sclerotic rim? When there is a growth of a tumor, there is formation of a sclerotic rim, which is a protective factor which prevents the growth of the tumor. But in this case, there is no sclerotic rim, which is generally a thick covering. So there is no sclerotic rim. So when a bone lesion grows slowly, a dense margin is formed around it. The most common radiological finding is soap bubble appearance, which is multiloculated radiolucent lesion and thin bony septum. You can see this is the soap bubble appearance. Expansion of the bone, cortex become thin. So, due to the expansion of the bone, means when the tumor grows, the expansion of the bone occur and the cortex become thin. So now let's go to the histopathology. There is presence of two main features. One is giant cells, another is stromal cells. Giant cell. So these are osteoclast-like giant cells with numerous nuclei of 20 to 100. These are uniformly distributed. The stromal cells are main neoplastic component. These are mononuclear cells. These may be round, oval, and spindle-shaped. The nuclei of giant cells resemble like nuclei of stromal cells. In this image, you can see these are the osteoclast-like multinucleated giant cells, and these are the stromal cells. These are the stromal cells, and the nucleus of the stromal cells looks similar of the giant cells. So now let's see the mother tissue. There is connective tissue stromal cells, presence of bony matrix with bony spicules, lacunae containing osteocytes and osteoblasts. So the mother tissue is bone. So now let's see how can you identify that the slide is of osteoclastoma. So first take this slide, focus it on scanner view. After focusing, you can see the multinucleated giant cells. These are the giant cells. In this way, you can identify that this slide is of osteoclastoma. So this much for today's video. Thank you.